Dr. Darren Markland joins me now, intensive care physician and nephrologist. Doctor, great to have you back on the program.
And thank you. It's nice to be back.
What are your thoughts on what you're hearing from the Premier and what you're hearing from doctors in terms of what the most important next steps are for Albertans to keep everybody safe, to lower the curve, to bend the curve downwards of this virus?
We have always had a disconnect between the expertise of the medical community and the political views of our Premier. As a result, Alberta has had the worst outcomes when it's come to COVID, and this unfortunately continues. I mean, we recently had a cabinet shuffle, and my hope has been with the replacement of Mr. Shandro with Mr. Copping that we might start off on a fresh footing. But it's really clear that we're in trouble here in Alberta. I can tell you personally that the shells are in the air. I mean, we peaked at 2,200 cases about 7 days ago. And following the natural time frame of COVID infections, statistically, we're in for a tsunami wave of cases. We've literally doubled our capacity, and I have no understanding of how we can get it any higher. These measures that have been recommended are important because if we guess wrong, we are truly going to have to triage patients. And that has never happened before in our system.
Have they already got it wrong, though?
Absolutely.
Yeah.
Consistently wrong. This is the fourth wave. Our passport system isn't called that. It's called an exemption program, exception program, for a reason. It's political, and it was designed to fail. The passport is completely forgeable. It's an editable PDF. These measures have been almost purposely undermined for political gain, and that's at the expense of Albertans' lives.
I want to read to our viewers a couple of tweets that you've put out, and it really does highlight, what you've been talking about here. You say here, what keeps us away from the brink that is triage is the number of people who are dying in our ICUs. I've had to show them that though not yet dead, they will never get better. I have extinguished their hope. I've had to console their children and bear the partner's rage. And then you go on to say, please take this amazing remedy, get vaccinated for those who love you, so that we do not have to break their hearts when we ask them, what would he want us to do if we cannot cure him? What do you want Canadians to hear? What do you want that 20% of Albertans who still are not vaccinated, who the Premier feel, regardless of what measures they put in place, won't follow those public health restrictions?
Well, the Premier's wrong because he's driving wedges in our population. Most of the people that I see are people who are disadvantaged. They are too busy or overwhelmed or undereducated or the victims of bad information. That's why they're unvaccinated. Our messaging around vaccines in Alberta has been it's been all over the road. We should not be assigning blame to the unvaccinated. They're a rarity. There are truly very few people who are established hardcore anti-vaxxers. Making it easier, bringing the vaccines to the people who need them, a consistent message, all of those things will get those 80%. And yes, there may be a very small group of people who go out and are very visible on media, but that's not what I see. I see people who, when they truly understand what's going on, have regret. And this is a disease that does claim those people in the end. And the anger is really just the cognitive dissonance of finally realizing that they wish they could go back in time and fix it.
I appreciate you giving me your time. I have one last quick question. I can hear the exhaustion and frustration in your voice. How are you doing? How is your team?
My team is incredible. The fact that we were able to double our capacity is just a sign of the commitment, both to administrative and the individuals. But I can't think more than a day ahead. It's getting harder and harder to go to work. We need help. We need our provincial government to do the right thing.
we commend the work that you and your team and all the doctors across this country are doing, and I really appreciate you, as always, giving us your time. Dr. Darren Markland, intensive care physician and nephrologist. Stay safe and well, doctor. Thank you again.
It's a pleasure. Take care.